All right, let's get the party rolling today. Make sure you're not blocking your view, whatever. Today's talk is about pain
in the neck.
Pain in the neck, pain in the neck, pain in the neck, headaches, whatever it might be. Okay, so we're going to talk about, first of all, what's the cause of neck pain? What's the common cause of neck pain?
Stress.
Stress?
Maybe it's the pillow.
Pillow? When you wake up like, oh, what the heck happened to my neck?
Pillow.
Bad posture?
Yes.
Good posture, huh? Or bad posture? It's up to you.
Heavy tinge.
What's that?
Heavy tinge, pick up.
Exactly, yeah. It can happen, or accidents too, right? I had two patients this week tell me their kids were hit by a car.
Yeah, my daughter
One
did.
riding a bike and one was just crossing the street. So be careful out there, okay? Don't look both ways and keep looking. You know, that's one thing you gotta be careful with. So those are normal causes. Want to make sure over time, how do we sometimes correct that? Is it a bad pillow? Is it poor posture?
Right.
Is there something that we can control, that factor, that variable we have to watch for to make sure we're doing the right things to correct that? In the process of, with my patient being a chiropractor, I always show them stretches, exercises they can start doing. And then how often should we do the stretches, exercises?
Every day.
Every day, good, okay. Form that habit of doing them, but
Not very often.
we have to do it every day. You don't have to, but I don't want neck pain. I tell my patients, don't do your, if the patient tells me, especially the younger, they go, I'm still invincible, doctor. I'm like, then don't worry about stretches, you're fine, have fun. You know, if you're still invincible. I don't think any of us here are still invincible. We all feel, okay, I take care of my body now, right? Okay, so we want to start understanding exactly how to get that better. From neck pain, can the neck pain travel from the neck down the shoulder, down the upper back, down the arm, or, you know, even causing the common culprit is headaches. Headaches back of the head or headaches forehead.
What about the one here?
The headache one, yeah, the head vice one, that would cause a full circle of a headache too.
Only in here.
It causes here, left side, right, even eye pressure too.
Yeah.
People have that stuff. I have two patients come in because they don't feel any neck pain, but they have eye pressure. I adjust their neck, give them chiropractic adjustment, their eye pressure goes away. They go, how's it work? I don't know, just magic. Just magic. It's all connected by nerves. So I always ask my new patients, does the neck pain stay in the neck or does it travel anywhere else? That's sometimes neuropathy where the nerves will travel to the head, down the arm, down the shoulder, even down the back. All right? Any questions so far?
How about tearing?
Excuse me?
Tearing.
Yep. It causes tearing also too. Realize a lot of stuff in your face, even facial, it's called trigeminal neuralgia, where the nerves from the brain and the neck, they cause pain in the jawline. I have a patient right now, she just had her baby, but before that she had trigeminal neuralgia where one side of her face was numb.
Bell's palsy.
Bell's palsy, trigeminal neuralgia, same thing. You know, so you gotta kind of figure out what the source problem is and you can figure out how to treat it, right? That's the plan. Is it cranial? Is it nerves in the spine? Where it might be. Okay. So now going to headaches. What are common headache triggers? What are triggers? I had a patient come today with migraine. Light sensitivity. Sometimes food or smell too.
Blood pressure.
Blood pressure, exactly. That's a good one too. So any senses in your body can be affected. Any change in your body, even stress, lack of sleep. Okay? So you gotta really watch. I always ask patients, if you have headaches, what's your trigger? What's the variable that sometimes makes you? I had a patient, I've seen him this year so far, he all of a sudden, just his body changed. If he had anything with salt, he would vomit profusely, having a major headache. Anything with salt. Goes to the restaurant, he says, I just want a piece of chicken, nothing on it, plain, nothing. If not, it causes him to really cause a lot of nausea. So you kind of watch what your triggers might be, and as we know, as we age, sometimes things will change in our body.
So it's allergy also, right?
It can be allergies also too.
What about arthritis?
What do you mean?
I have arthritis in my neck.
That can cause pain too. But arthritis is sometimes arthritis builds up over time, right? Okay, it doesn't happen overnight. So what triggers you to have pain yesterday? Had pain a couple days ago, last week.
The right pill, the wrong pillow.
The wrong pills.
Wrong pillow.
Or we do the right things to stretch and move things around. So we can have arthritis. This is one thing we gotta kind of know. We can have arthritis in our body, sometimes with age, sometimes with injury, but it doesn't have to cause symptoms. If you do the right things to stretch and strengthen, maybe ice, whatever it might be.
I forgot about
I face all the time to have arthritis in their spine. I go, yeah, you have it, but you didn't have it. You've had that, say, the last 4 or 5 years. Well, why do you have pain this week? What made you want to come in today? So I kind of want to see what the cause might be short term, not just the long term issues like arthritis. But good arthritis. All right. So, and what are common types? I had to talk about a little bit of the migraines. What's the definition of a migraine medically? Is it just the head pain? Is it just the light sensitivity? It's actually the nausea. That is the definition of migraines is nausea. You kind of want to watch what your head is coming from. Is it light sensitivity, what it might be, or like sometimes stress? Lack of sleep can cause that headache too. So kind of figure out what it is. What we do overall is figure out, we talked about how headaches are linked. That can cause from the neck to the head, even down the arm for one, too, or down the back. I patient a lot of cashiers. Cashiers all day scanning things, leaning over their counter for one, too. So their back does this. So when their back does this, it hunches forward, all of a sudden that pain is in the back and the neck together, right? If my body's like this, okay? And my body should be here, okay? But if I'm here, now you compress the neck together, upper back is arched forward. Once your body goes to forward hunch position, everything compresses together. Pushes the nerves together, get things moving for them too. You got to get our body back. So one thing I talk to my patients is beyond the stretches exercises, how do you sit daily? So I'll show you this position first, right here. Get the camera just a little bit low so you can see my feet too. Your feet are important when you talk about posture and sitting position. So here, if I'm sitting properly, I want to make sure my hips are on the first third of the chair. What I tell my patients is the back of the chair is only for decoration. All right, it's not there to actually help your body at all. Because if you use the back of the chair, what's going to happen is you start doing this. You're going to get a little stool up here and just hang out and go and get up and like, oh, my back hurts now. Avoid that. Yeah, that's part of it. We've got to make sure. So this is I want to say the better position to sit with is you want your knees below your hips here, feet underneath you. Excuse me. And you want to make sure your lower back, if you're to push your lower back forward, should bring your shoulders back. You want to feel like your shoulders and lower back are lined up together. So by doing that, then your head can slowly come back also. And now your shoulders drop, so you're in a better position. This should be the same position from your hips to your shoulders and neck as you would be standing. It should feel sometimes uncomfortable if you're not used to it. This is your position right here, because your feet are underneath you, either underneath the chair or on the sides. Now your hips can clear to go forward, arch your lower back a little bit. If your back is arched, then it opens itself up. Not cause compression. If my back is more arched, upper back is then same thing, more flat, and my neck can come further back to sit in my ears, ideally over your shoulders, over the midline of your shoulder. So that position there, or here too, see from this side too. You do both angles, same thing. Feet underneath me, knees below my hips, head up, chin back, and arms relaxed. And smile because you have good posture.
It's like a string.
Exactly, pulling
With a
yourself
string,
up.
yeah.
Pulling yourself up. It's going to feel, when you first do it a couple times, maybe in a week or so, it's going to feel uncomfortable. You start feeling comfortable, fine. You start feeling painful, give yourself a break. Give yourself time to change your habits. You haven't done it already. Your body learns over time, not your body, your brain learns to make this your default, not this your default. When the patient does this for a while, so they have a desk job, use their brain more. At that point, they go, I don't feel comfortable anymore. I'm like, well, good. I did my job. Thank you. Appreciate it. You know? But it takes time to get there. It doesn't happen overnight. Any questions at all? All right. Good. This is what it comes down to. We have to think about long term. What's the long term cause of our neck, back pain, or headaches? Not just short term. changing habits is the key when they're not right to make our body get better. Okay, like stretching is when? Every day. Why? Because I want to feel good today and tomorrow. I don't leave my house, maybe I have a mental problem. I don't leave my house until I stretch and do my exercises so I know I can have a good day. My cousin, just side note, my cousin's birthday was today, he's in Florida. He's 64 years old, ER doctor. I text him at 5:30 in the morning, hey, happy birthday. He's like, what are you doing up? I'm like, I get my stretches in before I see all my patients. I want to make sure I'm ready to go. I'm 52 years old, I can't just get up and go anymore. I had to break the rigor mortis every day. I can't just go. So you have to give yourself that time to really warm your body up. All right? Now, the exercise and stretches. I always start my patients with stretches first, because if they come to my office, I'm coming in, hey doc, how's it going? Like, they're coming because they have a neck pain, or back pain, or shoulder pain, or headaches. So I want to start them slow. Stretching allows things to open things up and then lengthen the muscle ligaments. What does that mean? If someone's in chronic pain, which is usually about 3 months, okay, that tells me everything is now shortened to make this their normal position. Normal tissue has now shortened and become more locked up. You have to get time to lengthen everything, to open things up, get things better over time. You can't rush that process. So when we stretch, we want to stretch and hold these stretches, okay? It's not a movement, okay, back and forth. That's more for the muscle on the outside, okay? I'm not worried about that. That's going to be more of the soft tissue. The tissue that holds the bones together, either this position here, your posture here, or a good position, are ligaments. Ligaments are a thicker tissue. They need time under tension to really stretch and hold that stretch. Muscles need more of the movement. That's a big difference. Okay? When I treat someone, I'll make sure I'm changing the ligaments more the long-term posture holder, good or bad, not just the short-term muscles. We do that afterwards once the ligaments once someone feels good with their stretching, then we move on to exercise. We start with stretches first and exercises second. Okay? So the first one I'm talking about is upper trap. Real simple, you do it seated. Okay? Bring your right hand, just to do the left side of your neck, behind your left ear. Okay, let me turn my body a little bit.
If you can reach that point.
Right hand behind your left ear. Turn your head to your left shoulder as far as you're comfortable. Now with your right hand, bring that head down toward your body. Just let the weight of your arm bring your head toward your body. Okay? Simple one, right? And you want to do is hold that stretch for about 30 seconds.
Turn to the left.
Yep, we're good. Turn your head to your left, and then head down toward your body. You don't have to really force it, just hold that area. You're going to make a little bit of an ugly face because it's going to be a little sore. Okay, that's a good thing. Okay, good? Okay?
Yeah.
Good.
I have so many pain.
That's okay, we'll work out one at a time.
And also my position
Mhm.
is not okay because when I was young, my habit is eating
A little more
different.
compressed
Yeah.
together.
The
So,
posture is not okay, and right now I have so many pain for back and neck.
so the goal is to make sure over time we work on each one and slowly get things to change. Because part of it too, you mentioned, which is perfect, I forgot about that one. When you have bad posture, not only is your head forward and your upper back is hunched, but like you mentioned, shoulders also roll forward in.
Yes.
So now these are part of the problem.
Yes.
You gotta fix all 3, 4, 5, 6 problems slowly over time, focusing on the structure, and over time structure is good, get the body further back. Just takes time. You know, we're gonna be around for a long time. We gotta make sure we start to have it slowly. Feels good, we add another one. Feel one more stretch feels good, add one more. Give yourself time to get your body to change. You know, we all sometimes want not a quick fix, we want everything at one time. The problem is do everything at one time, nothing's gonna really fix. So one at a time we'll work on. So that one again, right hand behind your left ear, upper trap stretch, turn your head to your left shoulder, let the weight of the arm come down toward the body. Okay, 30 seconds here, and then if you've done that long enough, now switch sides. So this one, I'll show you from over here on this side. We now bring your left hand behind your right ear, turn your head to your right shoulder, as far as you're comfortable, and so let the weight of the arm, now let that weight of the arm bring your head down toward your body, so looking to your right shoulder, head down toward your body, and hold that for 30 seconds. And smile, as you're stretching your neck. All right? It just works. But it takes time. If I have a desk job, I'm doing this at least once an hour. And what should you stretch when you have pain or before you have pain? Before. Okay, put yourself on a timer. Okay? At that point you don't think about it. Because you're working whatever it is too, you're on social media, on Instabook or Facegram or Tic-Tac-Toe, one of those places. And you're going, okay, all of a sudden, it's been 3 hours. You get up and all of a sudden your neck and shoulder hurts. You want to do before that happens. I say once an hour. It depends how busy they are, how much they move around. Some people have a stand-up desk, which is better. Depends what it is, you know. Who wants to try the stretch? Anybody? Come on up. Okay. Grab a seat, grab a seat. Find an opening or crawl on a desk if you want. It's up to you. What's your name?
Eggy.
80? Tony, nice to meet you. Grab a seat. So let's do your right shoulder first. So there you go. 80 right there. Let your hand turn a little bit more.
Only one
Boom.
set?
What's that?
One set?
One set, yep. Good. And then head down toward your body. So want to go higher up over your head. Sorry I messed your hair up, apologize. Right there. There it is. How's that feel?
I have pain, but it's good.
Good. When
I'm
you say
feeling
pain, is it guarding and tightening and
Yes.
spasming?
Mhm.
Okay. So only enough where it's uncomfortable, maybe right about there. Because once it almost starts to guard and tighten, you're almost defeating the purpose. Only stretch enough to where it feels uncomfortable, but not where it starts to get painful and tight.
So if it is the right arm, you have to turn left.
Exactly. And you're
The
stretching
left
your
one is you to turn right.
perfect. And then if we're stretching, if the right arm's over top, we're stretching the left upper trap, right here next from your neck to your shoulder. Switch sides, switch sides. Switch. So let's bring your left hand behind your right ear. And what we'll do now, turn your head to the right shoulder, head down toward your body. With the left arm coming over top, now we're stretching the right upper trap, which is your shoulder, point of the shoulder, neck, and a little bit upper back. It's more of a triangle. Trap is triangle, trapezius, geometry, I think, or some type of math. In that whole area. All right. Does that feel good?
Yeah.
Are you smiling? Thank you. Grab the seat, grab the seat. Make sure you go back to your seat. Go.
What does
What's that?
Get Botox.
You get Botox, which can help too. I had a patient come in. She came in a few years ago, a patient of mine, a new patient, and she was getting Botox in her forehead once a week for headaches and migraines. One of those like miracle stories. I adjusted her 3 times, her headaches went away. No more Botox.
After exercises,
After the adjustment. After the chiropractic adjustment, yeah. No more headaches, so no more Botox. But she still did Botox to look good, I think, I'm not sure.
Now she's got wrinkles.
I got wrinkles, what happened to the face? Yeah, I don't know. But and everyone's different with that stuff. But people do Botox for headaches, for depression, because it's all connected. When you have headaches or neck pain a long time, does it affect your mood?
Yes.
Affect your psychology, affect your ability to sleep well. So that's what all the patients ask my patients. So it tells me how intense it is and how much it affects your quality of life, not just the headache or neck pain. Affects everything. Once they feel better, I go, are you still grouchy or are you better now? You know? So we want to make sure we're treating not only the problem, making sure the person's overall, the whole person is getting better too.
so what is the normal 1 to 10? Is it 2 or 3?
For what? For what?
For the pain, for the headache.
For the headache, it can be anything. It could be a 10 where they have it all the time. It could be 2 where it happens, they say, once a month. So everyone's different.
Yep.
Everyone's different. Everyone has different names and different type of symptoms. You got to max out with what's going on in their body and see improvement over time. And maybe too with the headaches, maybe putting ice on it also. So when you're icing your neck, anyone here ice your neck for pain? Anybody? So when you ice your neck for pain, for headaches, you want to ice, I'll show you over there too, behind the ear to about the middle of the neck. Behind the ear, middle of the neck, that to back here, your pockets in your neck, that are your suboccipital triangle area. Those pockets control the nerves that go from the neck to the head and back and forth. That's your bridge. So you want to make sure that bridge here in the neck is being covered by the ice pack. So you're lining the ice pack, maybe a little bit of a neck roll, so your head's coming back to get those pockets really iced down for about 5 to 10 minutes. So the ice pack goes here, top of the ear, to right behind that area. All right? One eye is high enough, not just the lower area, at the top of the neck. All right. Second one is the pillow. That's why I brought the table. We just went in bed, not the floor, because what's the biggest problem going to the floor? What's the biggest problem? Getting up. All right, gravity. Dang it! I want gravity to hit us all the time. Bad knees or bad back, or you don't have the life alert or something. I don't know. Okay, so I'll go here. I'll go on this side this time. I gotta go lower on it too. All right, so what I do too, if you haven't seen me with the camera before, I videotape this, put it on Instagram, or not Instagram, YouTube later. The bottom of your sheets, you'll see it, is you can actually go to it later and watch the replay on the YouTube link. All right. Anyone not know what YouTube is? Was it last year or a couple years ago? And people just didn't have social media. I'm like, good for you.
Yeah.
It's nice not to have social media.
Exactly.
So this is what I want patients and you guys to understand too. We want to get the head behind the body, to stretch it backwards in extension because our heads are normally in front of the body. Okay? So I start someone with a really small towel right here. And I want to do is, I'm going to try to place it myself. I want the towel to be at my shoulder level so my head falls behind the pillow. So to start with, what I do is go right here, make sure it's placed properly. Up, too high, too low. Let my head fall behind the pillow just like that. All right?
It's hyperextended.
I'm extending my neck a little bit. My head's still supported by the table too. So if that's comfortable with somebody, okay, if that's comfortable, what I'll do, if I see that, I'll actually bless you. You have some good friends over there, man. They want to get a hold of you. They want to get you have good friends over there. They want to get a hold of you.
Yeah, I'm turning down.
So what do you do now?
I gotta go. I pick up my grandson.
You can watch it. Yeah, you can watch it later if you want to take the paper.
Early day, yeah.
You get at the very bottom. You can watch on YouTube tonight. I'll put it on today.
Okay.
Yeah, we're good. Take care of your grandson. You're good.
What does it say in the YouTube? Is it Dr.
Excuse me?
What, in the YouTube, what do we look for?
At the very bottom, it's, if you go on YouTube, my YouTube channel, you'll see the bottom where it says you can chiropractic, and go to the playlist called the workshop.
Okay.
Yeah. Very bottom there. All right. So if that one towel feels easy, you can do is roll the towel up or double it up here, and over time you can is now use two towels to get your head and body, your head to fall behind your body even more. That's comfortable. Okay? We want to make sure these muscles in the front of the neck, they stretch, and the back muscles extend. They get that your body, the ligaments and muscles to reset here, or using gravity to compress our head backwards or decompress our neck backwards to cause that overall improvement. Right? Any questions about that? How long should we do it for? Start with 30 seconds. Feels good. If you get up and you're dizzy, maybe stick at 30 seconds. Feels like you can handle more, go to a minute. The most you want to do is 2 minutes. 2 minutes the most. Yes.
Is it okay for the eyes?
Yes.
This position?
Yeah, because you're not
because
going.
I have bleeding.
Yeah, because you're not going too far back, plus your head's supported too.
Oh, okay.
But I wouldn't do this one though too. Let me show you one more that some people do. Okay? So I wouldn't recommend this unless you're really flexible neck. Really flexible. If two towels feel easy, you can do is this one also. Bring your head off the side of the bed. And head fall all the way down.
Oh, yeah.
All right.
That's the weight of your head.
But if the other ones make just getting out of bed makes you feel dizzy, don't do that one. Nah.
For how long?
Yes.
For how long?
For this one be for 1 minute only. Other ones can be for 2 minutes total. When you get up, have a good day. When you get up, make sure you slowly get up and hold something so you don't fall forward. Okay, I want you to blame me if you have a head injury.
Yeah.
All right, I'm not responsible for your other stuff going on.
Yeah, sit
All right.
down in bed.
Any questions about this one? Call it a pillow stretch, very simple. Use a roll up bathtub if you want to, or a small pillow. Enough to where you feel wherever you're comfortable, your head comes back just a little bit. Feels good. Over time, you'll feel you can handle more. Add more to it. Okay, any questions at all? Nothing yet over there in the gallery? You guys are good? Okay.
So CPAP would do anything with that.
What's that?
If you're hyperextended like that, just CPAP, you don't have.
Oh, yeah. It's giving yourself time every day though too, right? 'Cause I'm trying to counter, just sitting normally, realize our head is not an even weighted ball. Most of the weight in our head actually is in our teeth and also in our facial bones. So we naturally pull ourselves forward. We gotta focus on getting these muscles, getting our ligaments muscles to stretch backwards. Once they're there long enough, we gotta get the area stronger around the area too, get things better. We have to also open the shoulders up too. Okay, so now the shoulder one here. Did I jump this one or is the other one between? Little stretch too, yeah, broomstick stretch here. I'm taking the broomstick, this one out of the way. Taking the broomstick and adjusting the camera so people can see it at home. Here. Take a broomstick, a Swiffer, a piece of pipe. Even if you want to take like even a belt, a long enough belt, whoever's coming for you. If you want to just take that, lock your elbows out. This so you don't cheat. Okay, no cheating involved here. You want to keep your head straight the whole time. Wherever you're comfortable, stand up to your straight, weight on your heels, and slowly keep your head straight. Bring that broomstick, that strap, that belt, that Swiffer, that piece of pipe far where you're comfortable and hold that position for 5 seconds. Okay? That feels good. Over time, do about 5 of these. Bring it back where you feel a little bit tight in your shoulders. Start making that face again. Hold that for 5 seconds. Once that feels good over time, you try to go all the way backwards. All right? This takes time. I do it every day. I tore my shoulder before about 8,000 years ago. So at that point, because of that, I do it every day. I keep one like a little Swiffer in my pantry, in my morning stretch on a cup of coffee. For me, I do 5 of these, even more if my shoulders feel tight, all the way through, all the way back. For most people, when they start, you're going to start by coming up where they feel a little uncomfortable, hold for 5 seconds, and then come back forward and do it 5 times. Right? And do them how often? Every day.
Oh.
Someone
Morning,
said in the crowd.
Morning.
I do it morning and night based on my workout or how I'm seeing patients today, so I'll do it. So I want to feel good tomorrow, right? I stretch today so tomorrow feels good. You know? We're all gonna wake up sore every day. I just think reality. But can we wake up sore, stretch and go, now I can go for my day.
Yeah.
Go hop around all day, like a little rabbit. I guess, I don't know. Being Easter's coming up, I guess, or a little leprechaun. All right? Whatever's your flavor, I guess. If it feels, anyone have shoulder problems here? Anyone have shoulder problems?
Yes.
Who wants to be by demonstrate for E? You're already good. Anybody else? Huh? Demonstrate. You want to help me demonstrate something?
Go ahead. If you want it, go ahead.
Go ahead.
Oh, okay.
Ladies first, he said. Said ladies first.
Do your practice.
Ladies first. You can go either way, that way. Find an aisle from the gallery. So, do it normal way first. What's your name again?
Perla.
Carla, Pearl. Good.
Perla, like a pearl. P.
Parla. The pearl.
Okay.
So go back.
Go back.
Cheater.
No.
Oh.
There we go. Arm
lock
straight.
it.
Arm.
Lock it.
Yes.
Lock it. Okay.
And now come back.
Come back.
Cheater.
Oh.
So go wire first. More. There we go. Let's do that one.
Okay.
She said,
Now this is harder now.
Nice and slow though.
She
Don't
wants
face
to
again.
Slowly.
There we go. There we go.
Okay.
Can I go down more?
Yeah, of course. Now go more narrow.
More narrow.
There we
Okay.
go. And now come back. Nice and slow.
Straight.
And stop where you feel uncomfortable. Right there?
Yeah.
That's it. Are you sure?
Yes.
Okay.
It's harder though.
I know. That's what I want you to do though, is practice that.
Okay.
Okay, Parla? All right. Salamat.
You did it.
Good job. Okay. And should we do just 1 exercise or 2 exercises or should we do them all? I do them all. It does when you do them every day, it does not take that much time. It's gonna be less than the time to watch all the commercials on TV. That is me. Okay, so next one. That gave you my 3 major exercise did by stretches for upper back and shoulders, and this will help too. This will help the shoulders now unwind the shoulders too, right? If I'm using the broomstick, I'm doing this. Am I just hitting the neck and upper back? No. Now the shoulders are also gonna unwind and open with the broomstick. Okay? So we get the body open here instead of close and hunch this way. With this little piece of tool you can have anywhere. I think mine's from Home Depot like at least 10 years ago. Crazy. 3 shoulder exercise. Okay. This is a good one because all you have to use is 2 water bottles from Sam's Club. Okay? If it's not Sam's Club, then I'm not gonna help you. No, maybe not. Okay. So now I'll demonstrate first. And this is 3 exercises in 1 exercise. That makes sense. 3 sub-exercises, if you want to call them that. Exercise 1A is I want to make sure with the shoulders, because the shoulders again help them. If they come back, that means the neck comes back too. The shoulders come back. Everything. That means your upper back also comes more extension versus stuck hunched and flexion. Number 1, I want to make sure these muscles here, your pec minor and anterior delt muscles, are going to be stretched out and lengthened by getting the body to do this. Open this way. So want to do, take those 2 water bottles from Sam's Club only. They're my sponsor today, I think. Here. And you don't want to do this, not chicken wing, not a thing. Elbows tucked in the whole time. Come back.
Okay.
Hold for say 5 seconds. And come back in. 5 seconds, 3 times. So again, come out, elbows locked in. 1, 2, 4, 5. Bend, and 1 more time.
So put your elbows near your body.
To your side, yeah.
Your
Lock
body.
them in to your side. Boom, just like that. And last time, 1, 2, 3, 5, we're gonna go. All right, so 3 times for 5 seconds. Any questions about this one? Simple so far. We'll get more complicated in a second. So exercise 1B of 3 shoulder exercises. Number 2nd one is here now. Elbows, shoulder. I do against the wall normally against the wall. Here. Now what I want to do is elbows stay at your shoulder length, or if you're comfortable here, go here. Doesn't matter to me. Okay, whatever your comfort level is, but this is ideal here. Now water bottles stay about 90 degrees to your shoulder. I'll show you right here. Shoulder here, and what I do slowly is come up and down. Elbows don't move. Hold that up there. Hold for 5 seconds. Relax down the level for 5. Come back again for 5. 3 times.
Elbows don't move, just stay.
Elbows
right
don't move. They don't do this. Just stay right there. Lock them in. Up. Hold for 5. Down for 5. 3 times. All right. Get the 5-3 thing going on. Exercise 1C of 3 shoulder exercises. Now, elbows at your sides, thumbs pointing forward. Okay? Lock your body in. You can either go straight up and down, or what I do is have go down just a little bit. Because this one I want to do is make sure these shoulders back here on both sides, your upper traps and upper rhomboids, all contract up, hold, and relax. Okay? Come up, hold, and relax. For 5 seconds again. So here, leaning forward, up, hold for 5, come back down. Where's my head? Up the whole time. Up, hold for 5, and relax. You want to make sure back here, you're pinching your neck to hold, then relax. All right, whew, it's exhausting. Take a nap after this. So come up for one, I'll show you real quick, I'll show you. As you can see, I'll make sure you're doing it right. We have some issues going on. So we'll do that. I'm gonna do the last one first in reverse order. Here, up here, hold for 5, and come back down. All right? All right, do it. Good. Elbows locked. Go ahead, bring your against the wall. Good. Good. Hold for 5. Pinch back here. Then relax. Good. Actually bring it down here. Good. And then up here again, arms all the way out. Good, better. Hold for 5, pinch, then relax. All right? Now another one here, we'll start with the second one too. Here, elbows locked into the side. See where my hands are? Let's bring the hands out this way. I want the thumbs in too for this one. It's a little bit tricky, there we go. And from there, what we're gonna do now is now come straight back. Good, hold. Head up the whole time, smile for the camera. And back here. How does that feel? Ooh, it burns a little bit. It burns. All right. Now last one. I had it right here. Lock the elbows, thumbs up. Good. Now we'll go 92 with the elbows. I'm a good. I like straight angles. That's me. Right angles, I guess. Here, out. Hold for 5. Elbows stay in the whole time. Back in. Good. Perfect. One more time. Boom. Solid. How's that feel? All right, go home and ice. Go home and ice. Go home and ice. Good, good, good. Thank you for your help again. Appreciate it. Any questions about those? It's kind of complicated a little bit. It's not an easy one. All right.
How about the something like this? Put your elbows together.
Here.
Yeah, and then put your elbows together. Your
Here, this one.
yeah.
What does that do?
I think stretch this.
Yeah, check this one here, which I like. That one would help your shoulders stretch everything here,
Yeah.
your medial belt, and your upper trapezoid too. So here, or even here too, bring your arm across this way. And hold that. Yeah, here to here is good too. Yep, perfect. You can, there's so many videos out there. I just want to make it as simple as possible. You don't have to buy expensive equipment. You have some at home, or go to Sam's Club. Or I'm selling these for $5 for my sponsor. All right, last one, because I have to get back to work soon. No, I'm going to get back to work. So here, I want to do, if this was a shrug, what are shrugs meant to do? Make these muscles, the back shoulders, like in the last one, stronger to hold your body back here instead of leaning forward. I want to make these muscles stronger. So a normal shrug, your thumbs are pointing forward, you're coming straight up. Okay, that's good, but I want to make sure we're getting the shoulders to come open. So what I want to do is bring your thumbs out with your Sam's Club water bottles, out, then come up, hold for 5, then relax for 5, and do that 3 times. So hold for 5, relax for 5, and one more. Hold for 5, 3, 2, 1, and relax. So remember, this one is not going to be here straight because that's going to promote almost this position. I want the hands as far as you're comfortable. Bring your thumbs out away from you to get those shoulders really open, to get back here, to really come up and tighten, squeeze, 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 squeeze for 5 seconds, then relax for 5 seconds. All right. Any questions?
Do you have to be standing or sitting?
I like it standing because it makes you think about your balance. If I'm sitting, I can do a lot of this stuff, but then your whole body might get stuck here. Right, good question, good question, good question. We always want to exercise in good form. Always want to start your exercise with good form, maybe seated or standing. Always bring your body back on your heels when we're standing to make sure our body stand up straighter than we normally would versus toes can naturally hunch forward on our toes. All right. Just what I see every day for the last 80 years in practice. So no. Yes?
You know, I see older people,
Mm-hmm.
they're like this, there's a hump there.
Mm-hmm.
But when they lie down, they're flat, they can do it.
Because that's more soft tissue. That's not bone. Because that area only builds up over time from a lack of motion. By doing all these exercises, you get the motion in the back here, so that Dowers hump in your neck can reduce or never form. This takes time.
Downwards,
It's called the Dowers hump.
downwards.
DOWER''S.
Downward
From
form.
Dr. Dowers,
Oh.
from Dower, Michigan, I think.
I was wondering,
I don't know.
how
Next up my head.
she could go straight.
What's that?
She could lie down straight for this.
Because it's not bone, it's hard, it's soft tissue.
I thought it was Dougers, like an old lady.
Dowsers, maybe, could be,
I think that was.
could be. I don't know. It's called the hump in the back of your neck. Don't get it. Never been good. But again, that's only because our body's used to this.
Yeah.
We got to get our body back. Whatever you guys want to do with everything I always talk about, do them every day. I'm a morning person, so I do in the morning. 'Cause at night, if I think I'm doing it, I'm like, I'll do it tomorrow.
Yeah,
Whatever is good for you time-wise, get it done.
but it's better in the morning, you know.
I can check out my list in the morning so I can go my day and have a leprechaun or an Easter bunny top the rest of the day. So I take my power nap, cup of coffee, and do it again.
You have to have a list what to do.
In my head, it's in my head because I do it every day.
Okay.
If I do, I'm like, I missed something. I did it over here. But I give my patients a video to watch so they learn how to do it every day. Because people's habit of not doing it is always stronger initially. Give yourself 2-3 weeks of doing it consistently, it becomes your habit. I've been making, once they tell me like, man, I forgot to walk today. Actually, I walked yesterday. It's their habit. Then they get upset because they didn't do it.
Yeah.
You know? I love it.
Uh-huh.
All right. Any questions? Again, $5 each.
What's next?
Next month is
Sciatica?
it is pain when you walk, steps to help. Ah, look at that. I thought about that one. I think I got lucky. Look at that. Pain when you walk, steps to help. That's like something I don't know.
Pain when you walk.
You know?
Pain when you walk.
So the big thing with walking is I don't want to hear my patients walk. I don't want to hear this.
Oh, yeah, yeah.
Or shuffling.
Yeah.
When they wear your shoes faster, well, the terrorists, you're gonna have to pay more for shoes. You know? Or see a cobbler, get your shoes fixed. I don't want that either.
How do you know when you need new shoes?
Is when
When you see the hole.
the hole for one, when you walk in water and go, why is my sock wet? Okay. When you walk in water, or is when your feet start feeling in pain from walking. So when the middle of your shoe should be nice and firm. So if you take your shoe and can bend it, and the middle part of your shoe is bendable too,
Yeah.
you need more support. A lot of shoes now are real light, so they're very bendable, but someone my age, I don't want that shoe. I want more support. I've torn my arm before doing marathon, triathlons, all that stuff too. So I want more support in my shoe where it's more firm, so in the middle of my shoe, I cannot bend. Or if you feel like, man, all my shoes feel like my feet are causing pain, maybe you want orthotic in your shoe. We'll talk about it next time also. I wear orthotics in all my shoes to keep my arch up. Arch support.
You insert?
All my shoes have them, yeah. I'm sponsored by it, but I'll bring them back and sell them next month too. Sell them to you guys. Or you can find Amazon, whatever. But it takes time. We have to learn our habits.